A Spokane City Councilwoman is calling on the mayor to take drastic actions to help prevent the coronavirus from spreading.
There are people who are not going to be able to go to work, who are not going to be able to, they're going to have to stay home with their kids and family members to care for them, and they still need to be paid for that.
Right now, Spokane City leaders encourage people to practice social distancing.
It's a question you have asked us a lot. Why preventing the coronavirus needs such dramatic measures when it has similarities to the flu. This morning, we'll show you the important differences. The big trending term this morning is social distancing. We're taking a closer look at why health leaders are encouraging it and how it helped save a city 100 years ago right here in the U.S.
Winter makes a comeback today with snow, wind, and very cold temperatures. Your weekend forecast is on the way.
Up with KREM starts right now with Jen York, Joshua Robinson, Evan Nurani, and Dana Marie McNichol.
Coming up now on 6:02 this morning, dozens of organizations canceled events or closed venues due to the coronavirus.
And we're talking about everything from professional sports seasons to popular travel destinations like Disney World.
And places closer to home like the Space Needle will be closed. Here in Spokane, the Fox Theater postponed some shows. And as you might know already, March Madness games that were set to take place here in Spokane are now canceled.
It's really tough to actually look at all of these different things, just seeing, I mean, I've been waiting for like a repeat, but there's so many, that's always a new one that's cycling in. So many things are being canceled, of course. Thank you for joining us on Up with KREM. I am Joshua Robinson, joined by Jen York. And of course, the effort to prevent the spread of coronavirus is what led to a lot of these large events and locations being sort of closed and being canceled, even though there are 0 reported cases right now in Spokane. Of course, we're going to break all of that down this morning.
But first, we do want to send things over to Evan Nurani in the Weather Center right now. Evan, you've been very busy.
Yeah.
We have one last hurrah from Mother Nature and Old Man Winter. Of course, this being the last full weekend of winter. And it's going to go out with a bang.
Yeah, it looks like things are kind of just changing by the minute as far as what we expect into the weekend. So far, first thing I want to know is that dry weather is what we see to start off the morning. Active weather begins in the afternoon and evening hours. What we see in anticipation for that is plenty on the screen for your watches, warnings, and advisories. Winter weather advisory for the area in purple. Everywhere in pink under a winter storm warning. Those are where the highest accumulations of snow will be. Wind advisories for western Montana and eastern Washington, including Spokane and Coeur d'Alene. Those are in addition to the winter weather advisory that's in effect. So you could start to see kind of that activity pick up on the west side of the state. Things are really minimal right now. Those darker gray colors indicating very, very light activity. Really not much as far as observations are coming in. But once we see those more vibrant white colors, that's where we start to see heavier accumulations and heavier downfalls of snow. As far as the next 12 hours go, like we talked about, mostly dry conditions into about the noon hour. Past noon is where we start to see things really change. A 30, 40, 50% chance of snow moves in past 3 p.m. Looks like snow showers are going to increase by the evening hours and then into the overnight hours. So by the time we wake up on Saturday morning, could see even more impacts. The evening commute could be impacted, but it looks like that's just kind of when these snow showers begin to pop up. Future wind gusts are going to be a concern too. The purple on the screen indicating upwards of 40-mile-per-hour gusts. That means that we could see some blowing snow move in as well. All in all, it's going to be a stormy weekend with wind, snow, and some very cold temperatures. We'll have more details on how those temperatures will rebound. We'll start to see a warm up on the way. Those details are in just a bit. Back over to you guys.
All right, Evan, thank you so much. Just ahead of 6:05 now, some people are worried about mounting bills and the lack of work amid the coronavirus outbreak. And with that, one Spokane City Councilwoman wants to make some temporary rules to protect workers. Nicole Hernandez is joining us now in the newsroom. Nicole, what are some of these proposed changes?
Yeah, Jen, so Councilwoman Kate Burke is asking the city to make it so that people won't get evicted or get their utilities shut off if they can't pay their bills. She's also asking City Council and Mayor Woodward to give people more paid sick time off. These changes she's asking for are technically called temporary moratoriums. They would not be changes forever, just until the coronavirus spread calms down. Councilwoman Burke says that doing these things will help make sure that families can still get the essentials even if they have to stay home from work.
if people are having to pick and choose what bills they're paying, we don't want lights to go off. We don't want electricity to go off. We don't want sewer and water to go off. Those are things that are essential needs for community members, and we need to make sure those stay on and that people are being protected through this.
So Councilwoman Burke says she doesn't know exactly how to make that happen, but she wants the City Council to work on it together. She's also asking for Spokane's buses and other transit services to keep running. Councilwoman Burke said she wants to, quote, make sure that those without transportation are able to access food, work, and medical care. So these changes might feel a bit extreme, but we're not alone in this. A lot of other big cities like San Francisco, Miami, San Jose are also thinking about doing these things. In the newsroom, I'm Nicole Hernandez.
Or later today on our KREM 2 app, where school leaders will continue to talk about more information about what's going on. Of course, we know that Spokane Public Schools and Coeur d'Alene School District are restricting activity involving groups of 250 people or more. Effective immediately, the limitations do not include regular school instructions or meals. Now, this morning, Governor Inslee's extensive plan to prevent the spread of the coronavirus has also gone into effect. School's been canceled in 3 counties on the west side, and that's about 600,000 students that will not be in school over the next 6 weeks. Meanwhile, closer to home, universities in our area are moving classes online after spring break. No grade schools in our area have been closed. District leaders say that they are working closely with state and local government agencies to make any determination regarding those school closures. Spokane Regional Health District is not recommending any closures or cancellation of school-related travel right now. And this morning, we are asking you to weigh in. You can head to krem.com/vote or our KREM 2 mobile app and tell us if you think schools in Eastern Washington should cancel classes to help prevent the spread of coronavirus. It looks like right now, 64% of you are weighing in to say yes, 36% saying no. Jen, I know a lot of this, of course, comes after we got a lot of new information this week, especially when it comes to that term social distancing.
Yeah, and so what exactly does it look like? We've heard it mentioned here and there, but it's sometimes maybe hard to imagine and really put into practice. Washington Governor Jay Inslee made the suggestion this week when announcing plans to prevent spreading the coronavirus. So we'll lay it out here. Here's what it means. At the very basic level, it means staying 6 feet away from others. People are also encouraged to stop shaking hands and cancel meetings with more than 10 people. Experts recommend practicing social distancing now if you are especially at high risk of serious illness from COVID-19. Now, high-risk groups include people 60 years old or older, those with underlying health conditions or weakened immune systems, and pregnant women. And we also want to take a closer look at why leaders are recommending social distancing. So let's start off by showing exactly what 6 feet of distance looks like. And we're talking about putting it into practice.
Here we go. We're going to show you right here. This will go 6 feet. So, wow, that's actually a little bit more surprising than I thought it would be.
Pretty far.
Yeah.
It may be hard to gauge throughout your TV, but if you're in person, I mean, it's considerable. It's probably about double what I was kind of imagining in mind.
Right. I'm going to let it go. It's not going to snap back and hit you, I promise. But we're going to move on, actually, because one of the reasons why that we're talking about social distancing is because we've seen graphs like this that health officials are kind of pointing to of enforcing some of these policies to stop any spike in deaths from happening. You can see right here, this is a perfect example. If you take a look at this graphic that is being shared this morning by the New York Times that was adapted from the CDC, you can how early protective measures were taken to really kind of limit these cases. But also to make sure that our healthcare systems are not taxed. Now, even though that term social distancing is a hot term today, it is based on a concept that's proven to work over 100 years ago. Specifically, we're going to look back at the year 1918 with the Spanish flu when it hit the Midwest. Our source for this morning is a research article from the Proceedings of the National Academy of Sciences of the United States of America. You can see this graph. There's a lot of kind of similarities to the one that we just showed that's going around today. This article suggests that back on September 17th of 1918, the first Spanish flu was reported in Philadelphia. If we follow this black line here, we're going to probably take a closer look at it. You can kind of see the impact of it as city officials really downplayed that flu. They even allowed large public gatherings like this citywide parade that we're going to show you. It came on September 28th. Numbers then started to rise after that parade happened, before social distancing ideas really started, like school closures or bans on other large public gatherings, but it was too late at that point. At their peak, the highest death rate was 257 people, and that's per a population number of 100,000 people in mid-October. Now, we're going to look at St. Louis, 900 miles away, where the first case of Spanish flu was reported a few days later, October 5th. It only took them 2 days for city officials to start actually implementing social distancing procedures. Those 2 days compared to Philadelphia's 16 days. And of course, you can see that the peak rate in St. Louis, much lower, only 31 people per 100,000 in the population, compared to, as I mentioned, the 257 in Philly. The point is, health officials tell us that they're implementing this social distancing idea to make sure that we don't have to inform you about any stories of spikes in deaths locally or statewide, because we've historically seen it works.
Yeah, and I mean, that was more than 100 years ago, and we can really look at the evidence to make our decisions now, and why our state leaders helps us understand why they're making some of these decisions now, while they might seem aggressive or maybe a little preemptive,
right?
And a little aggressive for that. You see what the results could be if they don't take action.
I think the thing that hit me the hardest before we really started researching that term, social distancing, it does sound like a hot button term. It sounds like something a lot of people are just saying, like a hashtag kind of thing, but it's clearly not. It is a concept that has been proven to work.
And again, social distancing, let's practice it again here. It's basically the size of this wall.
Yeah.
So there you go. That's how far you need to be away from others.
Of course, we have also received several questions and comments saying that asking questions like why we should care so much if coronavirus is so similar to the flu.
This morning, Nicole Hernandez is going to be explaining the difference between the flu and COVID-19.
So a lot of people are talking about how similar the flu and the new coronavirus strain called COVID-19 are. They do have some similarities, so it's a fair comparison, but also they're pretty different. So I just want to go over everything with you. So here are the ways that the two viruses are similar. First off, in your symptoms, those respiratory, fever, cough, aches, they're both going to be mild to severe, even potentially to death. Then they're the same in the transmission. So you're going to get that if you're in direct contact with someone, shaking their hands, or from the drops in the air from someone coughing or sneezing. And they're also both contagious before people are showing symptoms. And then as for treatments, they're both similar in that antibiotics do not help. But COVID-19 and the flu are also very different. Here's how. So in the transmission, we talked about how they're pretty similar in that, but there is one difference. COVID-19 might actually spread after a sick person leaves a room. So those drops that we were talking about in COVID-19 can actually stick in the air. They're also different when it comes to the vaccine. The flu has one, COVID-19 doesn't. Pretty simple. And then as for treatments, they're different because antiviral meds actually help the flu, but doctors are still testing antiviral meds with COVID-19. So with all of these similarities and differences, one thing we've been seeing is a lot of people comparing the amount of flu deaths to the amount of coronavirus deaths. We want to go over the numbers with you to show you that even though the flu has technically killed more people, a person is more likely to die if they get COVID-19. So here are the actual numbers. COVID-19, we have confirmed cases of 118,322. Of those, over 4,000 people have died, leaving us with a 3.63% rate for deaths. So we're going to compare that to the flu here. There's over 41 million flu cases this year, and these numbers are based on the World Health Organization. Of those, 46,000 people have died, but that leaves you with just a 0.11% of death rate. So that is 1 in 1,000 people dying from the flu versus over 3 in 100 people dying from coronavirus. One thing to remember, though, about these numbers is that most of the people dying, first of all, are older people with weaker immune systems, and also this confirmed cases number is just that, confirmed. So there are a lot of people who have had coronavirus that we don't know about. So a lot of these numbers are still changing, as well as some of these facts. This is what people are thinking right now, but the coronavirus is just so new at this point, this particular strain, that some of these things are changing as doctors continue to study this. In studio, I'm Nicole Hernandez.
All right, thank you very much, Nicole, for that explainer there. 6:15 right now, and a quick break is in store. After that, we're talking about the next major story of the day. That is snow and some very cold temperatures for the weekend. We're talking about that after the break.
And in the next half hour, we will take a live look at the big board. When the stock market opens, we will see how trading is impacted before it closes for the weekend.